Diabetes is a chronic disease that is common worldwide and can affect anyone. It is a lifetime disease caused by the inability of the pancreas to make insulin or to use it properly. There are two types of diabetes. Type 1 diabetes is caused by the destruction of the insulin-producing cells of the pancreas. It tends to develop before the age of 30, but may occur at any age. Type 2 diabetes is much more common and is said to account for more than 90% of all diabetes cases worldwide. This chronic disease starts mostly in adult life, but in some cases, it can develop in childhood. Carbohydrates are the body's principal source of energy. Simple, sweet-tasting carbohydrates, such as glucose, are popularly known as sugar. Simple carbohydrates are rapidly absorbed into the body, giving rise to high blood sugar levels. Complex carbohydrates are known to take more time to be broken down into smaller molecules before they can enter the blood. This difference is important in relation to diabetes. In response to a rise in blood sugar levels, the body secretes greater amounts of the insulin hormone. Insulin regulates the level of glucose in the blood. In type 2 diabetes, the body cannot use the insulin properly to reduce blood sugar levels. Therefore, these levels remain abnormally high. While the body attempts to lower the glucose level forcibly, this exhausts the body's insulin-producing capacity. At this stage, the affected person becomes insulin dependent.
We diagnose diabetes simply by a rise in the blood sugar over a certain level. And that level of rise depends on when the blood test is taken and certain conditions surrounding. For example, someone who has not had any food to eat overnight, if a blood sugar level is taken early in the morning before breakfast, we call that a fasting blood sugar level. If a fasting blood sugar level is supposed to be between 70 and 110, if it is above 110, then that person is diagnosed with diabetes. If the person has eaten food, there is something we call a glucose tolerance test, or we still expect the level to be within a certain amount. Certainly between 150 and 200 of a random blood sugar is considered something of concern. Once the random blood sugar is over 200, in almost all of the cases, that again is a diagnosis of diabetes. And of course, the line can be very gray sometimes, where you're not sure whether someone is outrightly diabetic or not. And we may just say that person has glucose intolerance or something like that.
Diabetes is caused by several risk factors. These include poor eating habits and irregular exercise.
There are some causes that we do have control over, and other causes we probably don't have much control over. As with most of these chronic diseases, there is a genetic predisposition. So you do find that people who have had a parent or both parents who've been diabetic, or relatives who've been diabetic, they would naturally have an increased risk of having diabetes. But there are some behavioral things that increases our chances of diabetes. And one of the first behavioral things is weight control. So obesity is a risk factor. Also, people's diet. You do find again that many people are not very concerned about what they eat and how much they eat. And so they eat lots of refined sugars, so to speak. And so we're speaking about refined foods in the shops, the carbonated beverages, even the simple things that we have, like the ground provisions and so on. Although they are very good, they are packed with starch. A lot of it, almost all of it, is sugar. And so if you eat too much of that, that can increase your chances of diabetes. So here we see that one risk factor is genetics, another is lifestyle, diabetic obesity, and another is lack of physical activity. Again, diabetes has been shown to show up in people who are less active.
A person may develop early warning signs of diabetes.
If you're waiting for a sign of symptoms, you might have already missed the train and you are already too late. So for this, I'd like to say the very first sign and symptom is no signs and symptoms at all. The important thing is to get your blood sugar checked, get yourself examined by a physician so he can detect early signs of diabetes. But the other signs that one can look for is urinating a lot. Some people just have to get up 2, 3, 4 times a night to pass urine. In the day as well, they may find themselves having to go to the bathroom very often. That coupled together with thirst, if you find that you're getting thirsty very, very often, those are the 2 most common signs of diabetes. The other signs and symptoms can be mingled into other types of problems as well. For example, girls may get recurrent urinary tract infection, or girls may get recurrent yeast infections in their vagina, and that can also be because of increased blood sugar levels. Other things are like lethargy, tiredness, fever, recurrent infections, difficulty controlling the infections that you have. Those are some of the other things that can happen.
Type 2 diabetes can be prevented even if a person may be predisposed through having a family history of the disease.
Type 1 diabetes, you can't really prevent it from happening. It just happens, and we don't know why, but it just happens. Type 2 diabetes, you can prevent it by managing your weight, because the larger your body size is the more surface area that the insulin in your body has to cover. And so you're already predisposed to that, especially if there's a family history and other compounding factors. So basically what people need to do is moderate what they eat, how much of it they eat. I'm not in the practice of telling people never. But I try to teach people how you can use some of the things that you like, but not use it on a daily basis, because it can be detrimental. It can affect your health negatively, and so you want to be able to do it, but let it be a treat and let it not be a day-to-day thing. So people knowing that they can't just eat the same foods every day, but they need to eat a wide variety of foods so that they get the different nourishment, the different vitamins and minerals that their body need for daily normal functioning. Physical activity is a must. Our lifestyle has changed so much that we're so much more sedentary now than we were 15, 20 years ago, and that I think is contributing to the obesity, which in fact would lead you at risk for developing diabetes.
If a person develops diabetes, it can be effectively controlled if diagnosed early and treated correctly.
Do the natural things first, which is eat better and exercise more. And if you're able to successfully do that and control your diabetes, you're going to find that you're going to be healthier, you'll be more energetic, you'll be able to live longer and have a better quality of life. Because the truth is, once you have gone to a stage where the physician have to go to the second level of treatment, which is medication, then your life takes a different turn, because these medications do have side effects on them. Medications that we use are what we call oral hypoglycemics. Those are tablets that encourage the blood sugar to go down. Some of these tablets increases the production of insulin, which is a hormone in our bodies that breaks down glucose. And other tablets actually increases the functioning of the insulin so that the muscles and the tissues pick up most of the glucose that we have. So the doctor may choose to put you on tablets, which is the second line of treatment. Please know your medication that you're taking. 90% of the diabetics in our country do not know the name of the medications they are taking. And when they get themselves into a position where you're the doctor or somebody needs to know what you're doing, they have no idea. The final treatment that we have is insulin. Some diabetics, depending on what type of diabetes it is, will have to be put on insulin from the get-go or from the time the diagnosis was made. Other diabetics, having gone through diet and exercise, not controlling it, having gone through tablets, not controlling it, then the physician will now turn to insulin.
There are nutritional food guidelines that a diabetic must follow, which can help effectively control the disease.
As a person with diabetes, the guidelines are basically similar to what you would do if you are predisposed to diabetes. But you have to look at the different types of diabetes because the management is a little bit different. You have type 1 diabetics who you would like to give a lot of carbohydrates, but the carbohydrates would have to be carbohydrates that are high in fiber. You want to get the fiber in. And in doing that, you also have to be able to manage that carbohydrate intake with the person's insulin, because type 1 diabetics, they must have insulin, right? Their body is not producing it, so they have to get it from outside. And so you have to be able to monitor that the carbohydrate load that you're giving that person per meal. Try to keep it relatively stable so that you're not having, let's say, 20 grams of carbohydrates at breakfast, but at lunch you're going to have 60, 80 grams. So you're loading up at one meal, and yet you're very low at another meal. Trying to prevent the person from going into hypoglycemia, which means that the blood glucose level drops. So that because when the person takes insulin, the insulin starts acting at a particular time depending on the type of insulin that person is taking, and then it peaks. So you have a peak activity, and during that peak activity you want the person to be able to have sufficient glucose in their system so that the blood sugar doesn't drop. So you have to be able to place snacks at strategic points within that regimen so that that person wouldn't have the effect of going into hypoglycemia. Whereas with a person with type 2 diabetes, snacks aren't usually suggested. It's not necessary. But you do have patients that will come to you and say, I can't just do 3 meals. And then you have to be able to work that out with the person. But you have type 2 diabetics some people will be diet control and they can do 3 meals with exercise. And you have persons who are on pills, and you have persons who are on pills and insulin or just insulin. So because you're type 2 doesn't mean that you don't need insulin. You may need insulin. And I have to emphasize that needing insulin don't mean that, well, you're on insulin now, that means you're on the end stage of the disease. It doesn't necessarily mean that. It just means that your body is not able to keep up, because as type 2, your body might still be producing some insulin. But it's either it's not in sufficient amounts or your cells are not recognizing that insulin to take up the glucose. So now you may need to get some insulin from outside in order to help keep your blood sugar under control. When someone is type 2 and they're taking insulin, sometimes they may need to have a bedtime snack, depending on when the insulin is being given. But they really don't need to have snacks. But they also need to make sure that the timing of their meal is consistent, as well as the carbohydrate amount per meal is consistent.
People with diabetes often have trouble with their feet. Over time, high blood sugar levels can damage blood vessels and nerves in the body. Nerve damage results in diabetic neuropathy, or the loss of feeling in part of the body.
Morning, Miss Menz.
Good morning, Mrs. Hopkins.
How are you doing today?
I'm fine, thank you.
Okay, you know what I come here to do?
Yes.
I come here to help you.
Yes, with
and
my
to
nails.
educate you and
Yes,
to
thanks.
tell you exactly what you must do to keep healthy.
Yes, thanks.
especially because you are diabetic.
Yes.
And we have to go through the complication of diabetics.
Yes.
And the importance of foot care.
It's important that diabetic patients take good care of their feet to reduce amputations and other complications.
Before I do your nails, right, I'm going to do your blood sugar.
Yes, thanks.
Okay, to make sure that your blood sugar is okay.
Yes.
Because if your blood sugar is high, you know that you'll have to seek medical attention.
Yes.
In my kit, I have here a file, I have a nail clipper, and you notice I do not use a scissors. And if I'm using a scissors, is a scissors like this, very special, just for clipping toes, not a straight scissors, okay? And these are your clippers here that I use.
Here are tips to help protect your feet. Wash feet briefly each day with warm, not hot water. Avoid soaking too long in water, since waterlogged sores have a harder time healing. Dry your feet right away, and remember to dry gently between all your toes. Check both feet daily. Be sure to check between all toes. Keep your toenails trimmed and filed smooth to avoid ingrown toenails. Treat bunions and corns. Stay soft but dry. Use a small amount of skin lotion daily, but be sure your feet feel dry, not damp or sticky afterwards. Try not to get the lotion in between your toes. Make sure shoes fit well. Check shoes for rough seams, sharp edges, or other objects that could hurt your feet before putting them on. Never walk barefoot. Always wear shoes or slippers. Consider shoe inserts to support feet. Ask your doctor for more information about orthopedic shoes. Tell your doctor about any changes in sensation in your toes, feet, or legs. Speak up if you notice pain, tingling, a pins and needles feeling, numbness, or any other unusual signs. Control your blood sugar.
You have to take care of your feet as a diabetic. If you don't take care of your feet as a diabetic, you will be in problems. Do you know the complication of diabetes? You can get eye complications. You can get cataract in your eyes. You can get problem with your feet, like decrease in blood circulation, decrease in the nerve sensation, which can lead to gangrene of the feet, and that can lead to amputation. So this is why it's very important that you take care of your feet. Today we see so much young people and so much people with amputation. And if they do take care of the diabetes, it's a probability they may not end up having amputation.
In Grenada, diabetics can access a range of services through the Diabetes Association.
The Grenada Diabetes Association is an NGO, and our main purpose is to bring together individuals that have diabetes, their family, that's individuals who may be affected by the condition, as well as the healthcare providers who would provide the necessary guidance to these individuals. It's an organization that has bodies, or should I say branches throughout the island, including Carriacou. And basically what we do is we act as supporters for individuals that have diabetes. We provide education, because education is the key in the management of the condition. The more the patient has an idea of what is happening to them, the more they'll be able to manage it. And apart from that, we conduct various sessions, seminars, workshops, conferences, and so forth to bring to the forefront the problems we're having with diabetes and how best we could control it. We have, as you know, many health stations around the country that are working with patients with diabetes. Within those various stations, we also have members of our organization, diabetic educators, who are there to help individuals that would have the condition. So if an individual has been diagnosed with diabetes and they need the guidance and assistance of the Grenada Diabetes Association, first of all, we encourage them to attend the clinics, the medical stations, wherever they are, do the regular follow-up as the doctor prescribed, as well as become a member of the association, because they will meet a team of people who will really work with them one-on-one to help them to manage their condition.
One of the services provided by the Grenada Diabetes Association is the Diabetes Resource Center. The center is housed at the building commonly referred to as the St. John's Ambulance Brigade building in Tantine, St. George's.
This center here actually provide daily services to the general public and persons who suffer, persons who is living with diabetes. Anybody can come and actually access this service here on a daily basis between the hours of 8 to 4. We have a full-time attendant here who is a trained diabetes educator who offers the service of glucose testing, tests for high blood pressure or hypertension. We do what we call BMI, body mass index, and we also do weight testing for weight. Now, these services are provided free. In addition, the Resource Center provides updated material on information in regards to the management of diabetes and its complications. So this material also is available free.
If you or someone you know is a diabetic, take advantage of the support services offered by the Grenada Diabetes Association. They are found in most parishes. For more information, call 407-4174 or 415-0638.
I'm a type 2 diabetic, not I'm type 1, so I'm on tablets. I'm not insulin dependent. Whatever I eat, I always try to eat it in moderation, not in excessive amount. And I exercise. I'm a farmer, part-time farmer, and I try to get as much of sweat a lot by going to the garden and using the cutlass and the fork and so on regularly and so on. I don't know how long I will live without any added complications, but what I'm conscious about is that I know it is a disease that I would have to live with for the rest of my life. There is no actual cure. When I go to a hospital to visit sick, and I go to the male ward and then visit the female ward, you will see more men in the surgical ward with having the leg amputated than ladies and so on. And I don't know what is the correct statistics yet in terms of the ratio of men to women in Grenada who suffers with diabetes. But it is evident that you see more men having one foot walking around than ladies. And when you ask them what was the reason, they said they were diabetic. So I always like to actually, appeal to men to actually take a little bit more interest in knowing about their health and checking the doctor more regularly and so on. Ladies tend to check the doctor more regularly than men. So that's one of the advice I always would want to give to the men out there, that it is necessary to know the status of in relation to those diseases that we describe to be chronic disease.
Effectively treating diabetes requires regular testing for glucose levels, a healthy low-fat, high-fiber diet, and increased physical activity to reduce body weight. If a doctor prescribes medication, comply with the recommended dosage.
Even if your family gives you a predisposition to become diabetic or overweight, it does not mean that you will become that. You now should start working early to prevent the onset of these things.
A balanced diet and regular exercise are healthy, give an overall feeling of well-being, and help prevent diseases like type 2 diabetes.